Conditions that affect the lower respiratory tract, including the bronchial tree and alveoli, result in compromised air exchange and oxygenation. Airway obstruction leads to infection, pneumonia, and may allow inhaled substances to be moved deeper into the respiratory tree. If the respiratory tree becomes acutely inflamed, the interior of the airway is narrowed and muscles constrict to narrow the tubules. When the inflammation becomes chronic, air is trapped in the lower respiratory tract, the alveoli degenerate and fuse together, and the exchange of gases is greatly impaired. As a result, muscular and cilial action are lost, and whatever enters the lower airway and alveoli becomes trapped, and gas exchange is chronically impaired. Treating and preventing chronic obstructive airway disease includes decreasing the environmental exposure to irritants, smoking cessation, using filter to filter allergens from the air, avoiding exposure to irritants and allergens, opening and conducting airways through bronchodilation, and decreasing the effects of inflammation on the airway lining. The first class of drugs are the bronchodilators, or xanthines. The xanthines dilate smooth muscles in the bronchi and inhibit the release of histamine to decrease bronchial edema. They are used to treat asthma. The drug has a narrow margin of safety and interacts with many drugs. Please see Table 55.3. The theophylline level that you need to remember is 10 to 20 mics per milliliter. Note that the higher the level of theophylline in the blood, the more severe the adverse effects. Please see that in your chart. The oral drug has systemic effects, and the nebulizer version of the drug has fewer systemic effects. Patient education is important on how to administer the drug, and if you're taking it orally, the patient should take it with food or milk to relieve GI irritation if GI upset is a problem. The drug can also cause irritability and dizziness. In the cardiovascular system, it can cause palpitation and lethal arrhythmias. It is important to teach patients how to self-administer inhalers and nebulizers. You will have test questions on this administration process and how to teach your patients. For an inhaler, shake the canister. The patient should then exhale. Place the spacer in the mouth. If the spacer is not being used, the instructions are to hold the device about an inch from the open mouth. Then, compressing the canister while inhaling, the patient should hold their breath as long as possible and then exhale through pursed lips. After administration, the patient should rinse their mouth and wash the spacer if it was used. To administer a nebulizer, the patient should sit upright or in a semi-Fowler position. Place the correct amount of liquid or the drug dose in the nebulizer chamber. Breathe in slowly and deeply during the treatment, and then rinse the mouth and clean the mask or device after the liquid is gone. Again, be sure to read the box and be able to teach the steps to your patient. The next class of drugs are the sympathomimetics, including albuterol, salmeterol, and epinephrine. These drugs act on the beta-2 selective receptors to cause bronchodilation and to increase the rate and depth of respirations. These drugs replicate the effects of the symptomatic nervous system and dilate the bronchi. They are used to treat asthma and exercise-induced asthma. For exercise-induced asthma, the patient should use the drug 30 to 60 minutes before they exercise in order to have the maximum openness of the airway tree. Cardiovascular effects are related to sympathetic nervous system stimulation. Albuterol is used to prevent and treat bronchospasm. Note that in your textbook it is listed as long-acting, but in other textbooks it is listed as a short-acting drug. And it is used as a rescue inhaler. Salmeterol is a preventative. It is only used as a preventative drug for exercise-induced asthma. Epinephrine can be used for acute bronchospasm and for anaphylactic reactions. Anticholinergic drugs include ipratropium, which blocks the vagal nerve to relax smooth muscles in the bronchi. It causes bronchodilation by inhibiting cholinergic receptors. It does not have the degree of systemic anticholinergic effects as oral drugs, so it can be used with patients who do not tolerate the sympathomimetic drugs that we just talked about. A contraindication for this drug is an allergy to soy products or peanuts because the vehicle used in manufacturing the drug has a protein that is related to peanuts. You should also use this drug with caution with patients with BPH and glaucoma because of the anticholinergic effects. An inhaled steroid that can be used is budesonide. It decreases the inflammatory response and decreases swelling to increase airflow. It is used to prevent and treat bronchospasm in asthma or COPD. Adverse effects include irritability and headache, and in the GI tract, it can cause a sore throat, hoarseness, dry mouth, pharyngeal and laryngeal fungal infections. So therefore, it is important for the patient to rinse their mouth after they use their inhaler. The inhaled steroids are not for emergency use and not for use in acute attacks. It takes 2 to 3 weeks for these drugs to reach their effectiveness, and their adverse effects are limited because of the route of administration. If the drug is not administered correctly, however, it can have systemic effects. For review, any symptoms lasting more than 1 week for the patient should go to the healthcare provider to be evaluated to find the underlying cause of their condition. Topical nasal decongestants, you avoid systemic adrenergic effects, they block inflammatory response, and may take 2 to 3 weeks to become effective. Always read over-the-counter labels for cough and allergy drugs to avoid overdose and toxicity. And inhaling a steroid to decrease the inflammatory response decreases the systemic effects that occur with oral steroids. Please review the case studies in your chapters related to the drugs that we are using, the nursing considerations, and be sure that you understand how to administer these drugs using nose spray, inhalers, or nebulizers for the test. Make any notes of questions that you can ask in class when we next meet. Thank you.